What is value-based healthcare? Value-based healthcare is a global movement that has arisen in response to an increasingly challenging healthcare environment threatened by escalating healthcare costs, rising chronic disease, aging populations, and increasing community expectations. Value-based healthcare puts people and communities at the centre of healthcare decision-making, providing a framework for restructuring healthcare systems and services with the goal of improving both health outcomes and the experience of care. But what do we mean when we talk about value? The classic definition conceptualizes value as the measured improvement in a person's health outcomes for the cost of achieving that improvement. In other words, healthcare value is created when the care delivered improves a person's health in the ways that are important to them, through treatments and techniques that are cost-effective and evidence-based. Do you know what the people and communities you serve really want? How we go about finding this out is essential to applying value-based healthcare. Some outcomes might be valued by clinicians, but not necessarily understood or valued by the people your healthcare service is designed to serve. For example, a person who has undergone a knee replacement might be focused on whether they can walk up a set of stairs, rather than the precise measure of the knee's range of motion. Outcomes in value-based healthcare are about reframing the way we traditionally think about healthcare measurement, from asking people and communities how are we as healthcare professionals and providers doing, to asking how are you doing. And the research shows that what does matter to people and communities is their level of comfort, capability, and calm. Value-based healthcare cost calculation requires consideration of both the direct and indirect cost of care. Direct costs may include the cost of labour or the resources used in treatment. Indirect costs may include travel associated with appointments, lost income because of missed work, or the environmental costs of carbon emitted as a byproduct of treatment. To maximise value, both outcomes and costs must be considered across a full cycle of care, recognising that a cycle of care can be provided by multiple providers over time. In universal healthcare systems such as Australia, value-based healthcare must also embed principles of equity and public value, prioritising the equitable allocation of resources to achieve the outcomes that people care about. In summary, value-based healthcare reorients the way we think about and deliver healthcare that considers a person's journey through the health system in its entirety, focusing on creating improvements in the outcomes that matter in the most cost-effective and equitable way. If you would like to know more, the Australian Centre for Value-Based Healthcare offers a range of resources and information accessible at valuebasedcareaustralia.com.au.